Very busy morning out there on the roads. 7:47, and for today's Foxy Moms Wellness Wednesday, we hear a lot about gluten and the problems it can cause some people, but did you know there are different types of gluten reactions? Dr. Caplan with Colorado Springs Allergy and Asthma Clinic is here to explain. Good morning.
Good morning. How are you?
I'm doing very well.
Good.
First of all, for people who maybe don't know, what is gluten?
Right, so gluten is a storage protein that's found in wheat, rye, and barley. Primarily. It's found a little bit in oat products as well, but primarily because of cross-contamination. But wheat, rye, and barley are the three grains that contain that storage protein called gluten.
Okay, and this I didn't know. There are primarily three types of reactions. So
right.
What are these typical reactions?
Right, so a lot of people come to us because they're having problems with gluten. There's gluten allergy, and gluten allergy is something that we test for. That's a skin test, and those patients will typically have eczema or upper respiratory problems, sometimes problems breathing or asthma. And then there's celiac disease, and celiac disease is the very serious disease. So that's the one where you get gut damage. That's autoimmune disease, and that can have long-term consequences as well. So we can test for that as well. It's a blood test. Sometimes those patients need biopsies as well. But the third reaction to gluten that's very, very real is a non-allergy, non-autoimmune reaction called gluten intolerance or gluten sensitivity. And so that's something else that we can evaluate to see if that might be the problem.
Is there one that's more common than the other?
Well, the gluten intolerance is most likely more common. Some of the younger patients we see a gluten allergy or patients with skin problems, but the celiac disease is really the one that you have to get tested for early. What we don't want patients to do is to go off their gluten and then say, hey, can you test me for celiac disease? Because to be diagnosed with celiac disease, you have to be on gluten. You have to be ingesting that. So getting that diagnosis at least ruled out before you go on your gluten-free diet is very important.
My goodness. Well, it's definitely a different kind of disease. A lot of parents, I'm sure, if they have kids that are suffering, they don't really understand it.
No, they don't understand it, and it's hard to know how to go gluten-free. When you talk about a gluten-free diet, it's very difficult to do. And if you have celiac disease, you have to be strictly gluten-free. And my wife has celiac disease, so our kitchen at home is totally gluten-free, and that's a difficult thing to achieve, but certainly very helpful. There's a couple of gluten-free restaurants in town too. Coquette Bakery, outside the Bread Box, and Tapateria in Old Colorado City have been nice places to go out for us. So it's very difficult to do, so you got to make sure you get the right diagnosis, and that's what we can help with. See us before you go off the gluten so we can get the right diagnosis, because with the right diagnosis then we can get you a prognosis.
And really, that's the treatment. It's just staying gluten-free. There's nothing you can take to help with these symptoms.
Currently, no. There's nothing you can take. They are working on that. They're working on some oral therapy or desensitization therapy, if you will, to try to get those patients to be able to ingest a little bit more gluten. But primarily, the treatment is the same. It's just the diseases are so different and distinct that the outlook from each disease is a little bit different. So again, just before you go willy-nilly off gluten, it's important to get tested.
All right, and tell people your website if you're interested in learning more.
So we're csallergy.com. We're having some technical problems with our website, as is the case, it seems like, currently, but you can also get to us from your website, from Fox 21.
And you see it there, fox21news.com. All right, we're getting ready to do trivia, so I got to ask you, get your take on that, because Thanksgiving's coming up. How early, typically, does your family get up, or do you think the average family gets up to start cooking that turkey feast?
Right. What's your guess, Doc?
So I would go 6 a.m.
That's one of the choices.
6 a.m.
That's what I said too. I'm thinking 6 a.m.
Fire up that trivia animation at 7.